Candid camera. Good morning, good afternoon, good day, wherever you are in the world, whatever time you're watching this, we are grateful that you are here. This is Marian LaSalle, my co-host Russ Johns, and this is Marketing Ideas That Work. Our sponsor is Agency 258, and we are on the TV channel called Future Media TV. It's all about the future, right?
Exactly. And thank you. And we have a very special guest today too, Marian.
We do. We have a very special guest. His name is Rob Bartlett, and he is from Direct Care Partners. I'm excited to hear his story. I'm excited to hear about his startup and how he's getting going with the marketing. You know what? That's what this show is all about, marketing ideas that work. But we're talking with real people. We're talking with people who own businesses, who are running businesses all over the country, all over the world. And we want to hear their story. So let's get right to it, shall we?
Thank you for being here, Rob. How are you today?
Oh, Russ, thank you very much. I appreciate the opportunity. And Marian, thank you for having me on your show.
So, Rob, you have another side and another dimension. Direct Care Partners is one of the projects you're working on, but you're actually, your history and your upbringing in business was really designed around, the arts, creative, marketing and design. So talk a little bit about how you got to this point and your journey and some of the things that you want to share with the audience today.
Okay, that's a great question. Thank you. So yes, 38 years is the number of years I've been in the advertising, marketing, communications business. Started out on the media side, actually. Sold advertising space in a newspaper. I sold radio time on a radio station.
Wow.
KGHL in Billings, Montana. It was a wonderful crossover format, country to country pop, if you will, in the early 80s. And then had a brief stint at an advertising agency, and I've been more or less in business for myself, self-employed, with occasional employment agreements over the past 38 years.
So you actually run, isn't it Bartlett Creative?
Bartlett Creative, b-creative.com is my marketing communications business name. Yes.
Fantastic. We'll put that in the sidebar so everybody can track you down under that moniker as well. So Billings, Montana. I didn't realize that you were in that part of the world.
Well, I was for about 5 years back in the late 70s, early 80s. Came to Texas in 83. Came to Houston in 85.
Oh, wow. So you've been here a while then. So Rob, tell us a little bit about the project that you're working on now that you're excited about, some of the things that excite you about this project and what your current passion is around the design and the marketing ideas that are working for this project. Okay,
good question, Russ. Thank you. So Direct Care Partners is an outgrowth of a business transition that I helped my old friend from high school, Dr. Brian Birdwell, who is an internal medicine physician who practices primary care in a market named Lawton, Oklahoma, which is in southwest Oklahoma. We spent 2 or 3 years transitioning his business from insurance reimbursement, like almost all the other doctors in the United States. They get paid by the insurance companies, which means their product is a bill.
Yeah.
Not necessarily a well patient, but a bill that they can get paid some portion of. And what my good friend Dr. Birdwell did was he decided to abandon the insurance reimbursement business model and go membership. So what that means is over a period of about 1.5 years, we gradually transitioned his primary care medical clinic in Lawton, Oklahoma, from primarily being paid by insurance companies and Medicare to all of his revenues now come from memberships by patients.
Wow.
So that's the transition. And it's fundamentally disruptive, which I think it's the That's right. It's fundamentally disruptive because it changes the entire model for how primary care gets delivered and how it gets purchased by consumers. A consumer in the insurance model has to go get coverage, and then with that coverage, most people have a copay, $25, $30 that they have to pay every time they go see the doctor. So in that model, the patient, or the consumer, let's just say, the consumer in that model is restricted by the insurance company, what the insurance company will pay, how it will pay, its terms, and so on and so forth. But the physician is also restricted by what he or she can do, how they can sell, and their entire marketing, if you will, is through the insurance companies.
So they're very limited in the scope of what they can produce, where it relates to getting patients in the door and being managed essentially by the insurance company, right?
I would use the word constrained. It's very constrained.
Okay, so what's the story arc in the marketing position that you have to use? What's the message that has to transpire between being constrained by the insurance company and then moving into the self-managed direct patient care model? I mean, that's a pretty big story to tell. That's a big shift in the positioning and the marketing, right?
No, well, it is a shift, and I think if everything were the same about the type of care, the quality of care, the way the consumer interacts with their doctor, their physician, if everything were the same, then it would be uninteresting. However, my good friend and business partner, Dr. Birdwell, says it changes everything. And the reason it changes everything is because one of the key drivers of quality primary care is time. The amount of time that a physician has with the consumer, the amount of time that the consumer has in the doctor's office or with the doctor by any interface, in order that the doctor gets to know the patient, gets to know everything about the patient has a chance, or the consumer has a chance to ask every question, explore every concern and consideration. In the insurance reimbursement model, the patient-doctor time is cut up into 15-minute increments. Many primary care doctors will say that their actual patient face time is more like 7 to 10 minutes.
Yes.
Yeah.
So in 7 to 10 minutes, if you're a CPA interviewing your client, if you're a lawyer interviewing your client to figure things out, imagine if you had to condense your entire professional interaction into 15-minute increments.
Right.
Imagine how business would grind to a kind of a slow crawl.
Oh, it would be.
So no wonder they're throwing pills at us, because they don't have the time to really dig in to figure out what's going wrong.
So throwing pills is one thing, and then referring up into the higher cost acute care setting, specialty medicine setting.
Right.
So in a nutshell, there's data out there, and I have that data available on our directcarepartners.com website. We have other data that we haven't posted that we will be posting in the near future. But a couple of very important pieces of data. It's very helpful for business people to be aware. This concept didn't just pop up in the last couple of years. There are physicians since 2004, 2002, and going all the way back to the guy I think most of us hold as the originator of this direct primary care concept, left his medical practice in 1997 and abandoned all of his insurance contracts and went direct care payment through a membership model in 1997. So that's really the origin. That would be Garrison Bliss, Dr. Garrison Bliss, an internist in Seattle, Washington. His clinic became QLiance, QLIANCE.com in 2007. He joined up with a variety of other docs, and they went out and got venture capital funding. And therefore, they've been able to do a lot of things with larger employers in the Seattle area. And they've been able to generate some data, some properly organized and vetted health informatics data, which shows consistently over a period of years that they can drive down the employer's healthcare spend by 20%.
And so from a marketing perspective, from a institution, say I'm an employer, is it the numbers? Is it the actuarial tables? Is it the accounting? Is it the finances for my employees, the benefit, that the increased benefit, or is it the decreased cost that seems to be more of a trigger, an emotional trigger for an employer? And that's, I mean, that's one piece of the puzzle, right? And then the bigger picture, if we could talk about it a little bit, is from the bigger picture is this is kind of a movement, as I recall.
Thank you, Russ. A movement. Please tell me how we can get the masses to get on board with this.
Yeah, because this sounds like really good stuff that nobody knows about.
People need to know about this. How are we going to get the word out?
Okay, so getting the word out is probably the next thing we should focus on. But the core business driver, and I appreciate your question, Russ, because what you're getting at is why would business care?
Yeah.
Why would any business, individual business or business as a, as
an individual like ourselves? I mean, we're small business owners. We're out there grinding every day. We're doing our thing, and insurance is expensive. I'm not gonna, it's expensive. So one of the best ways to get at your question, Russ, is to look at the antipodes, the extremes. On one extreme, there are very large employers that have their own corporate campus. Okay.
One of the software companies in Seattle, I believe it's Travelocity, but they're a large software company in Seattle. My good friend, Dr. Garrison Bliss, and his Q-Liance medical clinics went and entered into an agreement with that software company to actually put a clinic in or near the campus so that they would have their direct primary care physicians readily available. So that CFO at that large software campus, here in Houston, we've got what was Compaq and is now HP. But if you visualize a large software company with a large campus, they have a set of economic drivers.
Mm-hmm.
Now they are, by necessity, they're picking up close to the full tab for the healthcare costs of their people. Some of those companies will price it out so that the employee pays a certain number of dollars per month for their health plan benefits that they select from a cafeteria menu, and they might pay a slightly larger amount for spouse and dependents. But everybody knows that drill if they've ever been in or been married to someone or known someone who worked at a big company. So there are economic drivers specific to that setting. Now think about the employer that has between 2 and 20 employees.
Okay.
It's a completely different situation, and the economic drivers are completely different. So what Q-Liance says is that they can go into a large entity such as the Travelocity software company in Seattle and drive down their total healthcare spend by 20%. That's an economic driver that's worth taking a look at. The small employer who's under 50 employees does not even fall subject to the health insurance mandate under the Affordable Care Act. And in fact, an increasing number of those small employers have found it impossible to continue their group health plan. And some of them have found that there's actually a disincentive for a company under 50, 49 or smaller,
right,
who is not subject to the business mandate under the Affordable Care Act. They've actually found it disadvantageous to offer a group health plan because so long as they do, their employees can't get the subsidies. When they jettison their group health plan and the business owner himself or herself goes out on the marketplace and buys health insurance,
right,
and advises their people to all go out on the marketplace and buy individual plans, then the employees, who are at the mid to low pay scale can access the subsidies under the Affordable Care Act.
But
So
those subsidies are not going to last forever, and they're not going to be available, on an ongoing. I mean, there has to be some change that's going to take place. So would that be would that employer under 50 be a good candidate for direct care?
well, so this exactly gets to Marion's question. So how are we going to do this? So what Direct Care Partners does is Direct Care Partners goes to employers, and right now we're focusing almost entirely on the 2 to 50, with more of a focus on the 2 to 20,
Right.
because those many of those companies either never offered health insurance because they couldn't afford it, or those who did offer have dialed it back and no longer offer health insurance because as the rates have continued to go up, they're no longer able to afford it. So what those small employers can do for their people is they can decouple care from coverage, and they can offer a non-insurance employee benefit called either part or all of their direct care membership covered by the employer as a non-insurance employee benefit.
So what tools and methods have you used to actually connect with these individual companies?
Okay, so
because from the art director perspective and the marketing perspective, you understand how busy these people are that are in charge of this financial change in their company, right? And that has been a challenge. I mean, we run into the same challenge. It's like, okay, yeah, I don't have time this week. Let's push it out next week, and next week turns out to next month, and then you move on to other things. And it's a constant battle for small business owners to connect, educate, and learn about some of the techniques that are useful to use to save money for their business, right? But it's,
right.
It's that time and effort kind of thing.
So if we separate the antipodes, the 100, 500,000 or larger employer, cost savings is their driver,
right?
Pure and simple. For the 2 to 50 employer, the employer with 2 to 50 employees, that employer cost savings is not the driver. It's offering a valuable benefit that their people really appreciate, and is a benefit that perhaps their competitors do not yet offer. So it becomes more or less the same reason that employers since the 1950s in this country have felt like they had to offer health insurance, was to attract employees, good employees, the better employees, and the better health plan you had. Yeah, exactly. The more better talented employees you could attract and keep.
Right.
So employers have used that as an advantage. So where the employers who have 2 to 50 employees always get wasted by the bigger companies is the bigger companies can offer fatter health plans. Smaller companies are at a disadvantage. What a direct primary care membership does for a small employer between 2 and 20 is it becomes a direct relationship between the employer and the physician or the group of physicians.
Right.
And the employee has access to a physician in terms that are unheard of and unthought of today. Let me insert in the marketing just a quick description. One of the things that most direct primary care physicians do is once the patient comes in for their full workup is they have them sign a HIPAA waiver, which permits the doctor and the consumer patient member to communicate by text, email, and phone. So my business partner, Dr. Brian Birdwell, has a little over 300 patients today, a little over 300 members today. They all have his cell phone number.
Yeah.
So if something happens on Friday evening, if something happens over the weekend, after hours during the week, or they wake up, sick or feeling bad and they're really worried about what it is, they can text him, describe the situation. He routinely gets iPhone photos.
Yeah.
Of
Do I
a
need
rash, of a rash, of a this, of that, whatever. So it fundamentally changes the way a consumer interacts with their physician. That's a benefit to people, especially people who in the mid to lower pay scale, who have been working in small companies their entire life, who have never had a fat gold-plated benefits plan.
Right.
And their access to the physician has been through this veil of insurance control that limits the extent to which they can access their physician. So for a small employer between 2 and 22 and 50, it has the potential of being an enormous game changer for them and their people.
It's almost like saying, you come and work for us and we have a personalized doctor to help you along your journey in your healthcare model, right?
Well, Dr. Birdwell uses a term. He says, actually, I have to attribute this to another physician in Edmond, Oklahoma. She's the one who I first heard say this. It's like having a doctor in the family.
Interesting.
If you had an older brother, older sister, cousin, aunt, or uncle who was a primary care physician and you had something happen, you were really worried about it, you might call them up on the phone. Most people can't do that, but if you had a doctor in the family, you can. But if you have direct care membership and you're a consumer working for a small employer, you can too.
Yeah. Marion, you had a question?
I do.
Or a statement?
It's a question,
okay.
And I'd really like Russ to answer this, because I think that from what I'm understanding, that you're going to rely on the marketing of the people talking that are loving this. So you get an employer to sign on, and you're hoping that the people will spread the news. So I'm wondering, is that enough? Is that enough marketing?
Very good. That's a great question. And I see we're down to the last 8 minutes. So let me address the question of how we market this thing. And let's do it briefly by taking a snapshot. Let's just take a snapshot of this week. So full disclosure, we're still in startup mode. So to help the viewers and anyone tuning in and anyone who watches this broadcast in the future, there are two entities. There's the individual physician practice. My good friend, Dr. Brian Birdwell, has his clinic in Lawton, Oklahoma. It's Main Street Clinic. He's at 415 West Gore Boulevard in Lawton, Oklahoma. So he's got his own business, his own entity, and his web address is mainstreetdpc.com. So he has his own marketing concern. Now, Dr. Birdwell and I formed an LLC called directcarepartners.com. And so we're still, full disclosure, we're still in startup mode. We've bootstrapped it with our own funds. We've not sought any other investment, capital and so forth. So we are truly bootstrapping this. And we are at this moment still putting together all of the marketing tools, techniques, and resources necessary to address Marion's good question. But let's take a snapshot. Here's what we're doing this exact week. In fact, this exact day, when this broadcast is over, I need to turn my attention back to two things that we have on the schedule in Lawton. May 25th is National Senior Fitness Day. So we've entered into an arrangement an alliance with the local YMCA, which happens to be across the street at 5th and Gore in Lawton from Brian's clinic. Mm-hmm. And we will have Senior Fitness Day from 9 o'clock in the morning until about 11 in the morning at the Y. And what we're going to do is we're going to invite all of our senior members in the clinic, plus other seniors around town, to come down and find out about a program at the Y called Silver Sneakers. You can look it up. silversneakers.com, I think, is the web address, but search it on Google and it's readily available. Silver Sneakers is a program where Medicare supplement insurance plans and Medicare Advantage plans will cover the gym membership for their insureds.
What day is that again, Rob?
Silver Sneakers. It's May 25th.
May 25th. Okay.
So next week, basically. So there's a whole set of promotions around that will call a lot of attention to Brian's clinic and the fact that he offers membership. On June 3rd, we'll have an employer briefing at the Lawton Fort Sill Chamber of Commerce in Lawton. It'll be a brown bag lunch and learn from 11:30 to 1. Both of these events are posted as news articles, blogs on mainstreetdpc.com. You can read about them there. So what we're doing at the chamber is we're bringing in employers of all sizes, but in particular, we're promoting it to employers in that small business segment 2 to 22 to 50. And we will describe for them, we'll have a benefits consultant there. We have an alliance with the benefits consultant, a guy by the name of Craig Scarrato. His website is simplifywithanI-benefits.com. He'll come in and talk to employers about compliance with the Affordable Care Act and some other kinds of issues and that affect them. And then Dr. Birdwell will talk about how whatever their coverage ideas are, they can wrap those around the care solution, which is a membership in the clinic. So those are two particular local community active promotions that we spent quite a few weeks and a couple of months building up to the point where we could put these two events on the calendar in short proximity. There's probably no kind of marketing tool that we don't need to use, from blogs to Facebook to LinkedIn. We have a direct mail postcard. I'm new at this blab business, so I don't know where to show it. Right. We have a postcard that's going out to Fantastic. 700 small business owners in the Lawton area. We purchased a list from Warren Buffett's Info USA, and we are using that list to stay in touch. So old world stuff,
new world stuff,
direct mail, good old direct mail postcards, all the way to the most technological kinds of things. The Lawton Chamber of Commerce tells us that Facebook is a really good resource for them. And our new partner across the street, the YMCA, they have 700 members or 700 followers on their Facebook page.
Yeah.
And so those partners that we have entered into alliances with locally have a much wider Facebook and other social media audience than we do. So I expect that this will become one of the best ways for us to expand our following.
Well, Mary and I call it drafting, where you're actually looking at a bigger audience and you're just tucking in behind and saying, hey, let's do this. We're not competitors, and we're very complimentary in the audience and the interest in the audience. So it's amazing to watch this thing. And what we get excited about, Rob, is sharing things that are going to change people's lives, you know. And this is one of the areas I've talked to several people in the healthcare industry. You know, I've helped doctors build surgical centers, and so I have some experience in the medical industry. And it's just amazing to see how the transition will take place and how technology allows us to disrupt this industry. And marketing, like you said, you know, you've gone from, you know, traditional years of, you know, ink and paper and pencil to the digital age, and there are a lot of changes that are taking place. Marketing is the same way. Our messaging, our platforms, the way that we connect, ultimately is still based on having a conversation just like this, right?
Well,
yeah, it's human touch.
Yeah,
human touch drives.
Listen to that. What you just described, drafting, isn't that exactly what he's doing with the National Senior Health and Fitness Day?
Yes.
Because that is a national event that's going on. People are very interested in staying fit. It fits right into his industry. People are going to be looking at that. That is a perfect way to move with the crowd and be seen.
Well, it's
perfect.
Yeah.
Good idea. Yeah. Very good point.
So, Rob, thank you so much for being here today. And we're always excited to hear from, you know, startups and people that are right in the trenches, just along right with us, you know, doing the thing that they're passionate about, creating everything you can around the disruption of business and making improvements along the way. So applaud you and keep us posted on the progress along the way.
Russ and Marion, I can't thank you enough for having me on today. Thank you so much.
You bet.
It has been a pleasure.
Thanks for the interrogation.
Was it painful?
Oh, no, it was fun.
Yeah.
Blab is
don't
fun.
Forget, we are here every Tuesday and every Thursday at 8:30 Central Time, and we have fabulous guests just like Rob on. And you know what? Sometimes we even bring them back because they're so full of good information. So we just might have to have Rob back after his startup is over. I bet you he's not going to take any more appointments for any shows until after the startup is well on its way.
Or book him now for the future so we get his commitment to come back. So we can say, we knew you when, right?
That's right. That's right.
That's very kind.
So, if you would like to see the replay of this and learn more about Rob and what he's doing, please go to futuremediaassociation.com and just click on the TV page and you'll see all the replays.
And also,
so once again,
and also, Marion, don't forget to share the fact that we can also have guests on too. So
absolutely. If you'll look at the live chat, I have put the URLs in there for everything you could possibly imagine, how to be a guest on our show, and even how to get your own show. How about that?
Bingo.
So, yeah. So thanks again, Rob. Good to see you, Ross.
Thank you very, very much.
Have an awesome day.
Yeah, y'all
Bye,
too.
everybody.